The snowy weather and cold temperatures mean it's not only winter, but cold and flu season.
Dr. Jordan Roberts with Granger Medical is joining us in this sponsored interview by Optum to talk what we need to know this year. Welcome, doctor.
Thank you so much for having me.
Now, this is the time of year when we're all a little worried, all a little confused. Is it cold? Is it flu, COVID, RSV? How do we begin to start differentiating?
It can be difficult, especially in the first few days. The symptoms often overlap. Most of those viruses come into our respiratory system through our nose. And so often, some congestion, runny nose is common, regardless of what the bug might be. But the difference really between a simple cold is that, that tends to stay kind of up here, causing congestion and mild symptoms. Whereas things like RSV and flu and COVID tend to set up shop in other organs, like your lungs. And can cause a widespread inflammation and other symptoms like fever, muscle aches, chills, nausea, headache, those kinds of things. So it really depends on the severity, it depends on where you're hurting, and it depends on how long it's been going on.
And so whenever I think about it, especially as a mom, I'm like, oh, how high is the fever? Is it coughing? Is it in your lungs if you can hear it and feel it, and how bad they feel?
Exactly.
I think that's the difference between that common cold and then, oh no, there is something else we're dealing with.
And it's important to figure that out within the first few days, right? A lot of people ask me, well, when should I pull that trigger? When should I make the call? When should I go in and be seen? And the answer is the sooner the better. Because we do actually have some treatments against some of these viruses. They're not cures, right, but they are medicines that are antiviral, and they can slow down the progression of that viral replication. They can shorten the course of the illness, make the symptoms a little less severe. But with these medications, you have to get them in your system quickly, within the first, preferably the first 24 to 48 hours for them to be really effective.
That's really good news, because I feel like sometimes you hear it's a virus, you can't do anything about it, go home and be miserable.
Right, that's not necessarily the case. Unfortunately, we don't have antivirals for every virus under the sun, but we do have them for a lot of the big, bad, scary ones, like influenza and COVID.
And what's nice too now, a lot of times you can make an appointment via Zoom or
Right.
telecommunication and not make you have to go into a clinic.
Absolutely. A lot of practices during the pandemic, of course, made this 180-degree spin toward telehealth. And now that things are kind of going back to normal, as it were, we're seeing that taper off. But we still offer telehealth visits for those types of issues in my clinic, and my patients really appreciate it.
With so much going around right now, RSV, COVID's still happening, so much, what are some things we can just do just to be proactive before we even get sick?
Great question, because there are things we can do, right? We are not powerless in the face of these kinds of communicable illnesses. So a lot of the same stuff that your mothers have been telling you since we were kids, right? Wash your hands often, cover your nose and mouth when you cough or sneeze. Try to avoid people who are sick. If you feel sick, if there's any doubt in your mind, get tested and stay home. Call in sick for that day.
I remember seeing an article saying, do we have to mask up now every fall? Is that a way to prevent?
There are many cultures around the world that do that, and it definitely has been shown to reduce the risk of transmission. Now, in the United States, we never used to do that before COVID, and I think that it's really a personal choice. But I personally, in my office, we're still wearing masks when we see patients. I have a fair number of immunocompromised folks who only feel safe coming to see me because we have a mask policy in my clinic.
You also say, of course, to drink plenty of fluids, get extra rest.
Absolutely, yeah. That stuff, it's hard to overstate how important those things really are.
Especially this time of year when we're busy.
Right.
Take some time for some self-care.
And hospitals are also stretched thin with all of these diseases and conditions happening. Where can we find more information with you?
So, of course, the CDC has great resources on its website. My own academy, the American Academy of Family Practice, has great resources for patients and physicians on how to protect yourself against cold and flu, COVID, and RSV.
All right. And, of course, Optum.com/Utah, they can answer your questions.
Good reminder, stay healthy, everybody. All right, thank you to Optum for the sponsored interview. And Bree, over to you.